My name's Janice Belter. I'm a physiotherapist. I've been working at the Glenrose for about 16 years. I graduated from the U of A in 1990, and I've been working on the stroke and brain injury program for the last while at the Glenrose. Prior to that, I did work in acute care and worked in rehab in the US for a bit. So I think what's unique about stroke and brain injury is the variability of the clients that we see. I think you can see anyone from the sort of classic dense hemiplegia to the ataxic patient to the multi-trauma brain injury patient to the kind of high-level balance challenged patient. It's really variable. And the other thing I think that's unique is the complexity, because we have motor involvement, we might have sensory involvement, we might have cognitive involvement, we might have speech involvement. So it's just not sort of one area of the body we're working on, and we have to work together as a team to deal with all of that and treat the whole patient. I think that's kind of unique in neuro. What I like about where I'm working now at the Glenrose is it's a very team approach model here, and it needs to be because it's rehab. And so with stroke and brain injury patients, so I have a variety of stroke and brain injury clients, and the team approach, it really makes us seem like we treat the whole patient. And I work with OTs and speech therapists and psychologists and the physiatrists and nursing and social work, and you really get a good idea of what everyone's piece to that puzzle is and how important everybody is to treating that patient. The other thing I like about what I do now is the creativity that's required to work with stroke and brain injury patients. I think we have to think outside the box a lot and look at the strength problems, the balance problems, the tone problems, the cognitive problems, and really be creative and try and figure out how we're going to achieve what we want in a physical therapy idea and model, but maybe in not the classic way. So I really like that. The other thing that I like a lot with working here and working with the clients is in neuro especially, and this was not the way it was for me 20 years ago, is there's a lot more evidence out there about the plasticity of the brain, and so neuro is really a cool place to be. And there's a lot of technology that supports us. We use electrical stim, we use robotics, we have virtual reality. We do a lot of things that we weren't doing 20 and 30 years ago with neurologically impaired patients. So that makes it exciting, and there's evidence out there about the plasticity and how much the intensity is important, and so there's a lot of really good interest in neuro, and that's what really makes me excited about being in neuro now. The advice I would give to someone, especially like a new grad or someone looking at changing the areas they're working in, coming into neuro, would be to really get as many experiences as they can, and maybe not jump right into neuro. I mean, I think if neuro is a strong liking, I think it's still really good to have experiences in that acute setting, maybe acute neuro, the outpatient setting of neuro, and sort of the long-term setting of neuro, and patients who are, long time post a brain injury or a stroke. But also, I spent a lot of time in acute care my first few years after I graduated, and I still value that. I think that was really, really important. I learned how to handle patients, and I think handling is really big in neuro. And then as you gain experience in the neuro world, you learn specific handling techniques, whether it's NDT approach or motor learning or more functional based. There's lots of interesting handling, but I think the basics need to be mastered. And as a new grad, there's just lots of places to find it, and not always specialize too quick, and maybe that's just not what you want to hear, but I think it's really important to get lots of experiences. The other thing is to blend approaches. So I think a good piece of advice is there's no one way to solve people's problems with neurological impairments. So if you work amongst therapists who are really NDT based, or they're more musculoskeletal in the way they approach, or they're more functional in the way they approach, blend it all and look around and be observant and see what you see, because it really helps to have a lot of tricks in your bag with neuro patients. So I think it's a really good idea to do that. The other advice I think I would give someone who's starting to work in neuro, planning to work in neuro, or down the road works in neuro, and I think you hear this at school, is to push your patients. push them hard, because I think traditionally we didn't as neurotherapists. I don't remember really thinking that as a student, and I think the evidence has shown that we need to push them, and if we push them to challenge them every day, we see better results. So that's advice for someone thinking about going into neuro. It's just it's no different than working in a clinic and pushing someone to get those reps in. We need to push it for the muscle learning, motor learning, and the plasticity. Advice that I would remember, now I've been working for a little while, that has influenced me, I think, and you hear it again and again, is really think outside the box. And no matter what area you work in, but for neuro especially, is think outside the box, think of different ways to challenge people, think of using, things that excite them to bring into your therapy and get creative. So I think that's really, really important, and you'll hear that wherever you work. So really, really use that. In neuro, I think it's really important. Also, people have told me, I've worked with people who have a lot more experience than me, and I think my own advice to myself is to look around and be observant as to what other people's ideas of how they do things. There's really lots of good experienced therapists to learn from. And the other thing is to keep learning, keep taking courses, keep learning about different parts, different things to help you with your clients, whether it's taking, an acupuncture, getting your acupuncture levels, or doing vestib stuff, because we see patients with vestibular problems. Try and get your repertoire bigger and bigger, and always keep learning. So that would be my advice.